Hello, I'm Paul Headings working with Archie Headings and Fracture Central.
Romania is a country bordered by Hungary, Moldova, Ukraine, Serbia, Bulgaria, and the Black Sea. Within the country, the Carpathian Mountains make up most of the area. There's the Transylvanian Alps and the Danube, which cuts through the entire country, but the Romanian countryside is filled with absolutely beautiful hills. There are 7 different regions that make up Romania: Bucharest, Wallachia, Transylvania, Moldova, Maramuresh, the Banat, Crișana, the Delta, and the coast. We flew into Bucharest and then traveled to Botoșani, which is in the Moldova region. Romania was originally founded in 1859 when Wallachia and Moldova were united. This event was known as the Danubian Principalities. Later in 1877, the country would declare its independence from the Ottoman Empire. After World War II, Romania became occupied by the Soviet Union. They started as members of the Warsaw Pact in 1947, but on December 22nd in 1989, the communist leader Nicolae Ceausescu was overthrown in a violent revolution, and Romania was free. Some Romanian historical figures include Carol I, who was the first king of Romania. He was born on April 20th, 1839 in Prussia. He reigned as prince from 1866 to 81, and as king from 1881 to 1914. He was loved for his military leadership in the Russo-Turkish War, after which he would be crowned king. And Vlad Tepes, or Vlad the Impaler, a ruler over Wallachia in 1448. In his time as king, he was loved for fighting off the Turks, and was most known for impaling his enemies as intimidation, along with rumors of him drinking blood. Today, just about everyone knows about Vlad the Impaler through Dracula or other modern vampires. Romanian food revolves around meats as the main course, with breads, fruits, vegetables, and pickles as sides, but instead of having them all at once, they have a 3-course meal with a course for each type of food. Pickles are incredibly common in Romania since they don't stop with cucumbers. They go on and pickle tomatoes, watermelon, and peppers as well. Pork and lamb are very popular meats in Romania. They are used together in many dishes such as mici, a sausage made with lamb and pork served with mustard, which sounds odd, but it's actually quite delicious, and sarmale, usually pork wrapped in pickled cabbage served with sour cream. Romanians also really enjoy their alcohol. Soica is the national drink of Romania, and they have beer vending machines with 3-gallon bottles sitting around everywhere. On average, they have 2.5 drinks a day, and many Romanians drink homemade alcohols. The main religion of Romania is Orthodox Christian, which is like Catholicism, but it does have many differences. Instead of a pope, they have a highest bishop, who can be contradicted by lower positions. And while Catholics use Latin in services, Orthodox churches will usually use the native language. They also pray using icons, which will usually be in their houses, but there are icons spread all around the roads as well. I had the pleasure of traveling with an international team from the University of Kansas Hospital. On our team was Dr. Archie Headings, Dr. Kelly Stumpf, registered nurse Jordan Brook, surgical technician Angel Quinoas, and Dr. Ryan Smith. During our stay, we worked with Dr. Radu Melancha Sr., the chairman of the orthopedic department, and Dr. Melancha Jr., another orthopedic surgeon, Dr. Claudia Melancha, the anesthesiologist, and Dr. Tinka, the head of the pediatric hospital. We worked in the Mavromati Hospital and the Children's Hospital in Botoșani. We began with rounding on all of our patients every day. Because it's a trauma hospital, people are constantly coming in with injuries. The orthopedic service specializes in musculoskeletal injuries, which means at a trauma hospital that they treat a lot of fractures. Each morning, we would see the new fractures that came in, and we would watch how the Romanians came up with a treatment plan. And then we would also check on the patients that were waiting for surgery, or had had surgery. It's important to note that not all fractures are treated with surgery though. Some fractures would be treated in a cast. And after rounding, we would sometimes watch how the Romanians treated fractures in a cast. Once rounding was done, we would typically go to the operating room or the cast room. This is where we would spend the rest of our day, mostly treating fractures, but sometimes performing joint replacements or treating infections. From my dad's observations, it appears that the Romanians do not have as many infections in their hospital as we have in the United States. In addition, he has observed that the Romanians treat more fractures and casts than we do in America. Consequently, in their hospital, they have a very organized system for the application of casts used to treat fractures. Here is an example of a young lady who had a fracture of her wrist. You can see how displaced this fracture is on the X-ray. Here she is after the application of her cast and the realignment of her fracture. You can see how the cast is holding her bones appropriately aligned, thereby allowing her to heal in an appropriate position to increase her chance of having a good outcome. With respect to operative treatment of fractures, here is an example of a forearm fracture treated with a plate and some screws. I will let you hear my father describe what he learned from this operation.
Okay, the most impressive thing I saw from a medical standpoint today it's the general concept of how to do good surgery with few resources. For example, on the Galeazzi fracture, we had it's an isolated radial shaft fracture that had a butterfly fragment that was on the radial side. In my practice, I would typically do a Henry approach, which is a straight volar approach. I would go down, expose the fracture, and I would typically put a lag screw from radial to ulnar to capture that butterfly fragment. He doesn't have small lag screws to do that, so what he did was he did a direct radial approach and he used his plate to capture that butterfly fragment. So in essence, he was able to create a stable construct with fewer implants, but it was about just as stable as the one that I could create with the implants I have. The downside of that is that it probably creates some tendon irritation, but that's something that I think would be debatable based upon the patient and what the profile is to the patient.
Other fractures we treated included ankle fractures, scapular fractures, hip fractures, elbow fractures, bad hip arthritis, and femur fractures, to name a few. We also helped them perform the first successful arthroscopy of a knee at their hospital. Since the doctors in Romania are so hospitable, they made time for us to do something fun each day. This usually started later in the afternoon. The first day, we were going to go to a farm, but since it was raining out, we only had time to have dinner with them. They offer palinka or soika when they invite guests over, along with a feast with multiple courses. The second day, we went to see how traditional rugs are made, which dates back to the Roman Empire. On day 3, we went to an Orthodox monastery, where we drank soika, and then we saw some more traditional Romanian masks, clothes, and instruments. And on our last night, we had dinner with the Melanchas.
Both the children's hospitals and the adult hospitals have limited resources when compared to American hospitals. Regardless, they're very resourceful with what they have. The reason why we internationally collaborate is to develop relationships that foster peace between two countries, to improve medical care in each respective institution by allowing healthcare providers to see and be involved in treatments of pathologic conditions they do not normally treat, expose healthcare providers to new ways of treating pathological states they are already familiar with, non-operative versus operative, different non-operative methods, new manners of PT, new methods of casting or bracing, different operative methods, new surgical approaches, and new methods of repair. To expose healthcare providers to a new way of delivering medicine, such as differences in physician, nurse, and hospital chain of command, differences in patient decision-making, paternalistic versus shared, differences in use of medical equipment, conservative versus disposable, differing views on patient privacy, differences in physician-patient interaction, differences of hospital personnel, shift workers versus salary, differences in reimbursement fee for service, RVU-based, collection-based versus salaried. It forces you to understand the foundations of why you practice the way you do.